Hi, my name is Nathan McConnell. I'm a paramedic and EMS instructor in Brunswick County, North Carolina. Today we're going to talk about how to give CPR. Some of the things you're going to need are a pair of latex gloves and a face mask. First step in giving CPR is to first check your victim and see if your victim is conscious. You walk up to your victim and you'll say, hey, are you okay? If the victim doesn't respond, the next thing we're going to need to do is to open the victim's airway and check to see if the victim is breathing. We do that by using what's called a head tilt chin lift method. We take the head and we tilt it up and we look, listen, and feel. What we're looking, listening, and feeling for is we're looking to see if the chest is rising and falling. We're listening to see if we hear air exchange coming in and out of the victim's mouth, and we're feeling with the side of our cheek to see if we can feel any air movement. All right? If the patient is not breathing, what we want to do here is we want to stop and we want to go call 911. All right? Once 911 has been activated, when we come back to the patient, we start treating the patient. The next thing we're going to do is we're going to give the victim some breaths. We'll make sure that airway is open with a head tilt chin lift. We're going to pinch the nose off and we're going to give the victim 2 breaths. With each breath, we want to check to make sure that the chest is rising and falling while we're giving the breaths. Next thing we want to do is we want to remove the victim's clothes so we can get to the victim's chest. After that, we're going to take our hand and find the center of the victim's chest. And we'll take the heel of one hand, place it in the center of the chest, and then we'll take our other hand, cross the fingers over, and we're going to start doing compressions. All right? We're going to do compressions in and out for a total of 30 compressions. Okay? With each compression, we want to make sure that the victim's chest is going down about 1/2 to 1/3 the depth of the chest. All right? From here, we're going to continue these 2 steps. We're going to give the 2 breaths and the 30 compressions, alternating back and forth in between each one. If we have an AED available, at this time we will put the AED on the patient and let the AED do what it's supposed to do and deliver shocks if needed.